I'm Stephanie Petta, and I'm here today to talk about a very significant change in the level of emergency care that will soon be available to residents of Manatee, Sarasota, and DeSoto counties. I've brought a team of people here from Blake Medical Center to discuss the hospital's plans for a Level 2 trauma center. Before we begin, I'd like to take a moment to introduce our panel. First, I'm joined by Daniel Frederick, President and CEO of Blake Medical Center, a role that he's had for the past 9 years. Prior to that, Dan has served as the CEO of several other hospitals and has more than 30 years of hospital administration experience. Thank you for being here today, Dan.
Thanks, glad to be here.
Next, I'd like to introduce Dr. Brian Kimbrell, the Trauma Medical Director at Blake. Dr. Kimbrell joined Blake in September of 2010 and is a board-certified trauma surgeon and surgical intensivist. He has worked in multiple Level 1 adult and pediatric trauma centers over the past 8 years and brings a wealth of knowledge about trauma care to our team. Thank you for joining us today, Dr. Kimbrell.
Thank you. It's a pleasure.
I'm also joined by Lynn Grief, recently appointed the Vice President of Trauma Services at Blake. Lynn has over 25 years of experience in Level 1 trauma centers and emergency care settings. Thank you for being here today, Lynn.
Nice to be here. Thank you.
Okay, so I'd like to start off by asking Dan probably the most obvious question, and that is, why is Blake building a trauma program?
I think we looked and just saw an overwhelming community need for trauma. When you look at a map of the state of Florida, especially the West Coast, there's not a trauma center between St. Petersburg and Fort Myers. So you have this 120 or so mile gap where there are no trauma services available. And I'm sure Dr. Kimbrell and Lynn will speak quite a bit about the importance of time and getting people to trauma centers very quickly, getting to that definitive care. So when you look at the geographic distribution, it just kind of screams out at you that there's a great need for a trauma center in our area. And we're part of what's the state has defined as Zone 13. There are 13, or actually about 17 trauma districts in the state of Florida. We're in Trauma District 13, and it's a 3-county area made up of Manatee, Sarasota, and DeSoto counties, where the state has actually identified in running their numbers over the past several years that there's really a need for a trauma center in this area. So we kind of picked up on the cues from the state a little bit, and really when you look at the demographics, there's just this overwhelming need that we felt that we should try to meet.
Okay, so the state identified that there was a need in our area. Why Blake? Why is Blake a good fit to build a trauma center?
I think if you look at the services that we offer now, the quality of the services that we provide, the progressive things that we've done, it's kind of a natural fit for us. We've over the last 10 years really tried to become more of a tertiary regional referral center, and this is kind of the next step in that, to provide care for the sickest of the sick, I think, is the role we take on in our service area.
And we've worked a lot with the local EMS already in emergency care initiatives like the STEMI program and things like that, so it just...
It does. It's just that natural progression of things that we do, and the EMS has certainly been very supportive and will be a big part of what we do here. It will actually kind of change some of those things. Right now, a lot of the traumas have to be helicoptered out to different areas and stuff. This will really give our local EMS the opportunity to transport these patients to a local hospital and not have to leave the area like that.
That's excellent. Maybe, Dr. Kimbrell, you can answer the next question, and that is, what exactly is a trauma?
Well, trauma basically is any injury from an external source. So that includes, motor vehicle collisions, motorcycle collisions, boating accidents or collisions, falls, work injuries, assaults, gunshot wounds, stabbings, anything in that type of line is considered a trauma. And then what constitutes a trauma center is basically a hospital that has been designated by the state or the American College of Surgeons for having specialized care for trauma and being able to give that specialized care. And that includes having all the specialized physicians and staff in place and ready to see that patient as soon as they arrive to the trauma center. So they're there waiting for it, having that specialized equipment, having protocols, guidelines in place in order to give definitive and efficient, rapid care to the patient as soon as the most efficient way possible. And that's basically what a trauma center is.
Okay. And I understand that the state has designated that in Trauma Zone 13 that Dan mentioned that we should have 3 trauma centers. So I'm curious, why would they think that we need 3 trauma centers in our area? What's so important about being seen in a trauma center?
Well, basically, when you look at the rules for the state of all these trauma service areas that Dan was talking about, it actually states that there should be at least 1 in each service area. But then they also did later a survey of all the service areas, looking at each one individually, and then pick and actually even increase those numbers for some. And so ours was up to 3 because there's quite a concentration of a population if you think about it here, especially as you look at Anna Maria Island, Longboat Key, Sarasota, and right in Bradenton area. There's a big concentration of population there, and even expanding out to the rest of DeSoto County and Sarasota. But it has really expanded over the last few years. So because of that, the state felt that there was a definite need for having those trauma centers here for that population. And instead of having them have to travel so far and having longer time to get definitive care, to be able to stop the bleeding or whatever injury there was. And basically by doing that, it gives them better survival and also better recovery.
And that's because they're closer. I mean, we do have trauma centers surrounding us now, so why is it important that they be within our service area, a little bit closer to us?
Well, as I always like to say, in trauma, the name of the game is time. So whatever you can do to make that time faster, get someone to definitive care, and treat them sooner is better. So right now, currently, what will happen is there's an accident or a collision, and the local EMS will come there, assess it. If they feel that it needs to go to a trauma center, they then contact the helicopter service to come in, which they have to wait for, comes, lands, picks the patients up, then transports them out to that trauma center, which is currently the nearest ones, again, are in St. Petersburg or Tampa General, or if you're in the southern portion around Sarasota County and south, it'd be Fort Myers, and nothing really to the east of us. So this is really saving that amount of time. We still may need to, at times, to be able to utilize the helicopter service to get faster transport, but it's going to be quicker to definitive care and being able to get control of the bleeding or whatever injury it is sooner so that the patient has better outcomes.
The other thing it does by keeping people in our community, the families that don't have to travel to Fort Myers or to Tampa or St. Pete to visit, because the family is still a big part of that recovery process. Once Dr. Kimbrell and his team really get them through those first day or so, then it is important that the families are able to visit and spend time with those patients and help them through the recovery process. So their whole social network is here. Why should they have to leave the area to have this one level of care?
That's a really good point, because that is really a trying time for the family. So to add into that long distances of travel that they would have to go could be really a problem for people.
Sure.
What about the continuum of care? I mean, because you mentioned kind of the days after. Maybe you could tell us what it's like for a patient that comes in and kind of walk us through that. What happens from the time they get in the door to the time they leave, hopefully better and ready to return to the community.
Well, and as you point out, I always like to even talk about the continuity or the continuum of care in trauma. And it begins with pre-hospital personnel out in the field coming into the emergency room, where the trauma surgeon's there ready to see them as soon as they get there with the emergency room physician. Then going to the ICU, the critical care teams, the operating room, staff. We have physical therapy, occupational therapy, speech therapy, rehabilitation services, both for the acute side of the hospital, and then we also have our own rehab for inpatient rehab that's attached to the building for longer duration rehabilitation needs. We have neuropsychiatrists, psych capabilities, and just basically all those capabilities to be able to return the patient back to a productive life afterward.
So it sounds like there's a lot of pieces involved in that, and really the whole hospital is going to kind of come behind that.
Right.
So, Lynn, maybe you could tell me what is involved in building a trauma program. It sounds like there's a lot of moving parts here.
There is a lot, and we're doing a lot of work up front. What we are working very diligently on right now is setting up processes, policies and procedures, because what we have to ensure is that we have a systematic, organized approach every time, each and every time a patient presents to Blake Medical Center. So we're doing that. We are doing a lot of training and education of the staff who are currently here. They're very good. But now they'll be presented with additional challenges, different patients that they may not have seen before. So we're doing the education with that. We're bringing in speakers to talk. We are buying new equipment, so the staff have to be educated and trained on how to instantly work with all the equipment. Again, some of it they've worked with, some they have not before. We're also bringing in specialties, arranging to ensure that we have availability of a full spectrum of a team, as Dr. Kimbrell said, who are instantly available 24 hours, 7 days a week.
So when all of those resources are in the hospital all the time or instantly available to people with trauma, how does that affect other types of care that people might need when they come into the hospital?
It definitely elevates it. We talk about a halo effect, and the halo effect is everybody who now presents to Blake Medical Center is the beneficiary of a higher level of care. We now have the equipment. The staff are looking at each and every patient through different eyes because they've been trained to assess every patient in a head-to-toe systematic manner. And we keep going back and seeing how the patient is responding to interventions that we have. So it is a halo effect because I feel the standard of care is just elevated for each and every person who presents now to Blake.
And you talked about the training. I'm sorry, Dan. You talked about the training, and we're bringing in other people, not just the hospital, right? I mean, there's EMS and other folks involved, so it's
Right.
Tell me about that.
Actually, we have a trauma series lecture that we started last Friday, and we have guest speakers, and we've opened it to EMS and other pre-hospital providers throughout the community, Sarasota, DeSoto, and Manatee County, and had an excellent reception. We had an excellent turnout. Nursing students, we've just really extended the welcome to everybody in the community who are healthcare professionals to come and attend. And as I said, it was very well received. We were very pleased with our initial offering.
So it's becoming a real community-wide effort to get these patients the care that they need, which is great.
I think one of the major changes that you'll see immediately when you look at the hospital is the amount of people who are actually in-house 24 hours a day, 7 days a week. You know, up until now, we've run an emergency room and had a very efficient emergency room, but this kind of takes it to a whole different level and is really a whole different thing where we'll have a trauma surgeon, you know, like Dr. Kimbrell or one of his colleagues in-house 24 hours a day, 7 days a week that are just waiting for trauma patients. They have no other duties. That is their focus. So they're there on a moment's notice to attend these patients the second they get in the hospital. In addition to that, there'll be trauma nurses that will be stationed in the ER, but again, their focus is waiting for these trauma patients to come in and caring for them, resuscitating them. When they get to the hospital, there'll be an OR team in-house 24 hours a day, 7 days a week, anesthesia. Again, with that same thing, they're not there attending the other patients at that time. They're focused on trauma as those people come in. In addition to that, there's 11 different physician specialties that will be on call and immediately available to come into the hospital and attend the trauma patients. And again, it elevates the care for all patients that come in. That Lynn so eloquently talked about, the halo effect. It's not just good for trauma patients, it's good for everybody. I think the other thing that really separates the trauma center is you're taking this whole group of people and you've assembled them. It's making them work as a team, bringing them together as an orchestra, and really setting them up so they succeed, so the patients succeed in the long run. It's really, and these guys have put in just hours and hours over the last, year or so of making sure that everything is thought through before it happens. And that every possible contingency they're really prepared for. And a lot of it is it's putting people in that position to succeed and save lives, which I'm sure we will.
And Lynn, you kind of talked about those processes that we were putting in place now. I mean, it sounds like there's a lot of steps involved in building this and a lot of research, I'm sure, that goes into why you do certain things, and can you tell me a little bit about that?
We use evidence-based training, basically, and so we know from the research that's been done what steps provide the best outcomes, and that's what we are training and we're practicing. We will be running what we call mock traumas, so we will be bringing the staff in to say, if this type of patient presents, what are you going to do? So that when a patient does present, it becomes automatic. We're thinking as we do it, but the steps are very automatic. We are putting the emergency nurses and some of the ICU nurses through very advanced courses in how to instantly assess a patient who presents based on what we call the mechanism of injury. So we find out from the pre-hospital providers what happened to the patient, and that raises our index of suspicion of, even if the injury isn't immediately noticeable to us, we think if this happened, this is most likely the injury, so we're going to be running some tests. One of the pieces of equipment that we've ordered is an ultrasound. So Dr. Kimbrell and the emergency physicians can do a bedside ultrasound of a patient, so they can instantly see if there's perhaps some blood where it shouldn't be. Before, patients would have had to go to the ultrasound department. So that is just a quick example of how we're elevating the standard of care and the quickness with which we're able to respond to an injured patient.
And then we monitor all of that. So all of that gets reported back to the state then as we move and
Yes, the state has, we have what we call a trauma registrar, and we will be looking at each and every trauma patient who presents to us, and we report back to the state the outcomes, how fast it took us to respond to a patient who presented, and we will also be doing extensive quality improvement reviews. We will be doing ground rounds where we review a patient case as an educational endeavor. So there's continual learning as we start and continue. I think that's also part of the halo effect, is that the quality is ensured as we examine very critically our own actions and the patient's outcomes.
And how does that reporting, how does that work during the initial stage, the provisional status? Can you maybe explain how that process from the application and kind of the timeline and how that works?
Right now, we are in the process of applying for provisional status. So we have extensive requirements and elements that Dr. Kimbrell and I are going through painstakingly and ensuring that everything is in place. And so we will then, we've been reporting to the state and will continue, and we have deadlines that we must meet. And then we will put in our final application, and then the state will provide us with provisional status, and our goal is early fall for that. And then we can start accepting trauma patients.
So then we get that provisional status and we accept trauma patients, and then at what point does the state come back and review, or how does that next step happen?
Yeah.
Well, after the provisional designation or provisional status, we'll start seeing the patients, start collecting the patient's information in the registry, doing our basically quality reviews and doing the grand rounds, as Lynn pointed out. You have at that point, within a year, they're going to come back, about a year's time, and do a site survey. So then they'll review, look at all of your quality documents, paperwork, all the meetings that you had, who all went to the meetings, etc. Look at making sure all the policies were followed, the guidelines were followed, and then also take a tour of the hospital and see how things are working there at the hospital and in the trauma center itself. So that's in about a year after the provisional designation. And after that, they will give you final, complete designation. It will be a full designation at that point.
Okay.
And also during that time, they're looking at your outcomes. They mentioned the trauma registry. We're constantly submitting data to them that we're reviewing internally, obviously, and there's actually 2 new committees that are formed that Dr. Kimbrell kind of heads up. One that looks at the process of trauma in every case, and then another that reviews the actual patient for each case that comes through to make sure we're doing everything we can, to give the best care, but also to improve care as we go on. You can always do better in everything, and that's really one of the aims of the whole trauma program. So it's very intensified the level of review, but the state during this provisional period and forever looks at the outcomes. So,
which is good. So the
Yeah.
quality, and that probably allows us, as new research comes out, then to be able to implement those new changes. And when you're monitoring so closely, you can quickly make improvements and changes that really
And,
make a big
that's really
difference.
key portion of the trauma registry and why it's important for any trauma program is you can look at maybe some small issues or issues that you may have in your local area or your local facility, but also, as I pointed out, the local area, maybe you notice that there's a certain type of injury pattern that's very common. So not only can you be better prepared to deal with those injury patterns, but maybe go out and do outreach or prevention measures to go and talk with the community about how to prevent those types of injuries.
Right. Right.
That's a great point. And I think that we are planning to do a lot of trauma
Yes.
prevention education. And is that part of the process? Is that part of the application? Or
We've already begun it. It's the state wants to, and obviously we feel it's very important too, to go out and do education, to show how wearing a seatbelt saves lives. Truly, it does. We see it every day. Wearing a bicycle helmet is so important. Putting a child seat in the car in the proper manner can save lives. So those are all things that we'll be definitely involved in. The other thing too is we've set up we network with other trauma centers. So we share information, we learn from others, we attend trauma conferences. So we are always being kept right on the forefront of any new research that comes out, because we go to the conferences and hear the researchers present their findings.
and we're also part of another network.
yeah, we affiliated ourselves with University of South Florida College of Medicine, with USF Health, specifically for trauma. And they really bring a lot to the table for us. We're very invested in going out and building this center, but they provide a whole level of expertise that we didn't have in the hospital before. I mean, obviously, Dr. Kimbrell came from Southern California and was at some prominent trauma centers at USC and that. But the USF affiliation are local folks too, again, that can help us put this together and really share the best demonstrated practices. And the other thing is they're put together with our parent company, with HCA, 5 different trauma centers throughout the state of Florida that are all kind of coming on board at the same time. So USF is kind of that common thread that kind of binds us together and allows us to share those best demonstrated practices and make sure that we're all, up to date and doing everything, like you'd find anywhere in the world.
So it's really an advantage when you're bringing on a new trauma program then to have that level of support
Like
and
the
sharing
university.
from people who have done it. That's
Yeah.
great.
And that's actually an extreme rarity, I would say, for a lot of trauma centers to have that type of resource, especially educational and research oriented. It's just going to really elevate the amount of education that we can do for the physicians and other staff throughout our entire network.
Very good. It sounds like it's a really big investment. Can you tell us about?
Sure, yeah.
What's
It's
kind of
an
involved?
enormous investment. It really is, but exciting, and I think a great way to reinvest back in our community. The trauma center itself, the physical part of it is about a $2.5 million investment, where we're taking 5 rooms in the emergency department that are currently there and kind of taking those out and building 2 trauma resuscitation rooms with a room in between them for equipment, supplies, and everything to make sure everything's right at the physicians and the team's fingertips when trauma patients come in. So that part of it is kind of a one-time cost to make this investment in the physical structure. We're also doing some work out in front of the hospital with putting in a second helicopter pad and putting in some ramps and changing actually the traffic flow in front of the hospital to make it easier for emergency personnel to get patients into the emergency department. I think the bigger investment and the long-term investment are in the people that are going to be a part of the center. We estimate somewhere between $5 and $7 million a year in additional salaries and professional fees that we'll do. I mentioned that we'll have at least 5 trauma surgeons, like Dr. Kimbrell here, that are trauma critical care physicians that are taking care of the patients kind of on the front line. But there's 11 different specialties behind that are at a moment's notice that he and his colleagues can call in and have there. So that really adds a lot to the cost of it also. And in addition to having people in-house from surgery, from anesthesia, the extra OR nurses. So really it's an investment in the people more so than the infrastructure of the hospital. You know, it's really, as I tell people, when you hear about the trauma center, you're probably at home listening to it now and thinking, wow, this is really great, I can't wait to see it. You'll probably be disappointed if you did come and see it, because it's really just these 3 big rooms, resuscitation rooms. It's not a big building or anything like that. It's really about people and putting them in a situation where they can succeed, helping them build those systems and having the right folks in front. And that's where we've put most of our money into.
And it's something I think that we get asked is what's the cost to the taxpayer, but we're a for-profit hospital. So.
Yeah, we pay taxes. We don't take money. So really no cost to the community, and actually it's a great benefit to the community in the save lives. And we talk about lives as in everybody, you know, the mortality rates, but also in the morbidity and people getting that care quicker, where on the back end they can recover faster, they can become productive members of society again quicker after an accident. So.
Well, that's very exciting news for all of us living in Florida, particularly those in Manatee, Sarasota, and DeSoto counties, as we anxiously await the opening of Blake's Trauma Center. I want to thank each of you for being here today to explain this exciting advancement for the health of our communities, and I also want to thank our viewers for tuning in. If you'd like to learn more and find updates on the progress of Blake's Trauma Center development, you can visit blakemedicalcenter.com/trauma. Thanks again for watching.